Hi, everyone. Welcome to the Here for the Health of It podcast. We have a great show. We have Chelsea Turner, who's the owner of Roots Integrative Medicine in Forest Drive. Brand new place that's opened up, all kinds of integrative medicine approaches and information. And then we also have Bethany Bagwell, who does all, as they've described it, all the other things that are done there. So I hope you enjoy. We get into all the details of what they test for, why they opened it, and then what this looks like. So enjoy the show. Hi, everyone. Welcome to Here for the Health of It podcast. I'm Dr. Randy here with Dr. Tom, as always, and we are Columbia's hottest and fastest growing podcast. We have a great show, as always. We have Chelsea Turner, who's the owner of Roots Integrative Medicine, which is a brand new integrative medicine place in Forest Acres. And then we have Bethany Bagwell, who, as you described it, does everything else in the office. Yes. And we're really excited. So the short version is you guys are seamlessly combining traditional and holistic therapies to promote overall well-being, which we've needed in Columbia for a really long time. I constantly get asked from patients saying, I really want to go somewhere, but I don't want it to be just somewhere where they look at me, give me a bunch of meds, and don't care about any other part of my life or any other part of my health. Or they're saying, I want to try something else before I get on a whole bunch of medications, but everywhere I go, they just constantly do this or just hand me things. We've even had just complaint after complaint in the medical community where I think a lot of the times they're just either so busy or they've just been doing the same thing the same way that patients are like, I'm ready for something new, and they can't get it. So tell us how this whole thing started. Tell us about yourself and kind of give everybody an overview of what you do.
Sure. So I'm a board-certified family nurse practitioner. I graduated from USC with my bachelor's in nursing in 2013, and I started in family medicine as a medical assistant actually 17 years ago. So worked as a medical assistant, and then I graduated from nursing school, wanted some more exposure outside of family medicine, so went and worked adult critical care in the hospital, and then did some more nursing in deliveries and mother-baby, and then went back to school for graduate school. And during school, I did children's hospital work, nursing work, but always wanted to go back to family medicine practice. And so worked in traditional family medicine for years, and I kind of integrative or functional medicine kind of found me in an unfortunate event. My son, I have two sons, I have a 4-year-old and a 3-year-old, and when my oldest son, Finn, was almost 2, he got very sick with encephalitis, and he was seizing about 10 to 12 times a day.
My.
And so he had 266 seizures in about 5 weeks. So we were in the hospital, and because his MRI of his brain was normal, his EEG was abnormal, and the basic labs they did were fine. They just kind of labeled him as epileptic and gave him a bunch of seizure meds. It wasn't working. It just gave him a bunch of terrible side effects. And so as a mom with a sick child who's also a healthcare professional, I just kept asking why, and no one could really answer that, why this was happening. And I guess when you ask why enough times, it leads you into this kind of way of thinking with medicine and really digging for the root causes of his new onset, rapid onset seizures. And so long story short, we found a reactivated HHV6 virus in him that was rampant in his system that hadn't been checked, and a few other things, but he is thriving now off all seizure meds, no seizures for 3 years. We've done kind of the natural route there.
Right. Wow.
And that was really tough because the specialist, everyone in traditional medicine was literally rolling their eyes at us in the sense of, we want to wean him off of seizure meds and, go this other route. We think this is why he's seizing. And So anyway, that was really challenging in and of itself, but I realized that there needed to be a bridge between, yes, he needed seizure meds for a period of time, but he also needed we needed some hope and a bridge into this other side of medicine that was, that had more hope, I guess, you know? And so, had pulled at my heartstrings for a long time to kind of do my own thing, but the timing wasn't yet right, and then it became right. So I met Bethany through working in integrative medicine, and we clicked, you know, very quickly and have a lot of the same passions in medicine. So my son was diagnosed with PANS, which is pediatric acute onset neuropsychiatric syndrome. And Bethany also has 2 boys that have a history of PANS. So we've kind of bonded over that, kind of sadly. But, you know, thankfully, they're all doing very well. Yeah. And so, yeah, that's where I'm at. Finding the root causes to your symptoms and disease. And sometimes we have to go the traditional route. Oftentimes, though, we want to go towards the natural route. And that's who we are.
Today's episode is brought to you by our sponsor, Columbia Family Chiropractic, with 3 easy-to-get-to locations, one in Forest Acres, which is by Trader Joe's, one in O'Neill Court by the DMV, and one in the Northeast by Sand Hills. You'll be sure to have somewhere near you. They offer a ton of services from corrective care, on-site digital x-rays, spinal decompression for bulging or herniated discs, dry needling for injuries, pediatric care, and a Class 4 laser. They accept all your major insurances. And if you mention this ad, you'll get a discount on your first appointment. Check out their website at cfc4health.com or Google Columbia Family Chiropractic. That's cfc4health.com. And I've found there's so many people that are in the same situation that you were in, which is there's this issue. I know something's causing it. And everywhere I go, they just say, here's drugs, take it forever. Quit asking why. Just take the drug. We don't know why. We're not going to find out why. But it's unique that you actually could do something about it because of your background.
Right. And really putting into practice evidence-based medicine. There's so much evidence-based medicine in the natural medicine world.
Yep.
Right.
And, you know, again, a mom with a sick baby that was 3 months postpartum with my second baby, like I wasn't sleeping. So what I did was research, and there's tons of literature on reactivated HHV6 causing neurological involvement. And there just isn't a lot of the kind of people who want to learn that new way of thinking and then apply it to practice. So
Isn't it weird that during COVID, everybody was just saying, don't do your own research?
yes.
There was people saying, not your research, just trust the quote unquote experts. And you're like, wait, the opposite of science is trusting the experts. Science is figuring things out and questioning everything and then finding a better way.
Yeah, and that used to be me. I mean, I used to more blindly follow my the doctors I worked with, I trained under, and I think that they're wonderful doctors. I just think that until you're kind of put in this situation where you have to figure it out, you don't realize, wow, there's a lot we don't know and that we're not applying to medicine. So,
yep. I have an uncle who was a medical malpractice lawyer. And so he would have people after car accidents who were saying, you know, I didn't have this issue. Right after the accident, I didn't have it. And then 2 weeks later, I'd start having migraines and I could barely function. And he'd be up there like, so you're telling me that you've had no symptoms for 9 days and then all of a sudden you had debilitating headaches? And they're like, yeah, that's what I'm saying. He's like, that doesn't sound right. You should have them the next day. And then somebody was pulling off the freeway in LA, smashed him, flipped it over. And then he was like, I was fine the next day. I was fine for 7 or 8 days. And then all of a sudden he said, hey, I was like, oh my goodness, all these years I've been just almost like telling people, no, what you're experiencing is not reality when actually it is.
exactly.
And I think there's a lot of parents out there who need to hear that what they're experiencing is reality, even if they've been told it's not.
I mean, a lot of people, a lot of parents, you know, just the simple fact of we spend a lot more time with our patients too. We spend about an hour with them in their visits, and just, you know, validating that what they're experiencing, one, isn't normal. Just because you're tired does, you know, just because you're a mom doesn't mean that you should be exhausted all the time and depressed.
Right.
And so just validating people, and that just opens up this whole new door of healing, because then they trust you, they feel heard, they feel seen, and then they do get better. And so much of that is truly just validating them.
Yeah.
And we were told for years, I remember 14 years ago, 2010, doing a workshop on sugar and how it's not good for you. And the nutritionists were freaking out. You're extreme. You shouldn't be telling people not to have a balanced diet. They were really still pushing the food pyramid of you need all these grains as your primary thing. And then I remember vitamin D being the big thing. And when we started pushing that, probably 2014, 2015, all the medical doctors saying this is just expensive urine. It's not doing anything. Why would they tell you that? If maximum you need 500 IUs a day. And now all of a sudden, 10 years later, and people are like, no, you need a prescription for or they're being told you need a prescription for vitamin D. They're doing 50,000 IUs sometimes in a month. It's just the landscape is changing.
Yes.
And I feel like people are getting frustrated because they're like, wait, I knew this 10 years ago and I was told that I'm crazy. And now you're telling me, oh, this is the way that we do it now.
Yeah, absolutely.
So some of the things that you're doing right now, I think in 10 years will be just normal. Everybody will say, we always knew that.
Yeah.
Of course, whenever you have this syndrome, we look for a virus. That makes sense.
Exactly. And that's, we come across that a good bit. You know, we'll have, the latest was a chronic significant pain. I mean, maxed out on narcotics for years.
Right.
And had a positive tick-borne bacteria that was so high, the health department's calling me like, did you know this was going on? And I'm like, yes, we do. And we're trying to explain to them, no, this is not an acute tick bite. This is a chronic issue. And they wanted to document he was asymptomatic in the database. And so how do we learn if we're not documenting appropriately, number one? So our goal has been, well, we're going to call the health department back and make sure they document it appropriately.
Why did they want to make it asymptomatic?
It didn't fit in their box of bullseye rash and, you know,
Fever, chills.
fever chills.
right.
All those things.
So anyway, yeah, that's that, and mold and all of this are definitely going to be things in 10 years. I think we're going to go,
Yeah.
oh, yeah, this can cause a lot of health issues.
Yeah. And we love to research. We literally, if you scroll through like our text conversations, it's 90% like PubMed studies.
Documents?
Like
It really is.
up like,
Gosh.
oh, 1:30, I woke up, couldn't sleep, sent me a study. Like, so we love that the research is always
Right.
changing, because that means that we're getting better at finding ways to treat things, and we're always staying up on new things or things that we haven't discovered before, digging deep into it. And that's just kind of like, that's one thing we connected on. And I think people, like our patients, really appreciate that, because it's a lot of times in traditional medicine, not always, but a lot of times it's just kind of like, well, this kind of is the way that it is, and there's no depth of explaining anything. Like, a lot more people really want to know why, I think, than we give credit for. Like, patients
Right.
really want to understand the why behind things, and why are we prescribing this? Why am I taking this? How is this helping me? You know, what mechanism, how does this work? And we spend a lot of time educating and empowering our patients. And I always tell them, like, people who are interested in getting scheduled and want to, you know, kind of go on their wellness journey with us, it's like, this is totally different than what you're used to. This is more of a partnership.
Yes.
So we really focus on getting to know you personally, working with, you know, what she recommends or what I recommend, and then like with health coaching, and kind of going with just, it's more of a relational type situation.
And then gathering the feedback and making adjustments as you go.
Yes.
Yeah.
Yeah.
Because that was it. So I'm curious about this. Was it intimidating, especially in your case, Chelsea, with knowing that you are the potential answer for a lot of people that are out there, but it's anti, in a way, the establishment, the system, because when we became chiropractors, we're already the ugly stepchildren from way back in the day of like chiropractors were quacks and all that stuff. So we were ready for that essentially, right? And our philosophical approach is exactly what you guys are talking about, and just finding the root cause. Like that to me sounds very fundamental and basic. But when you went to open this clinic, because it's new, have you had a lot of intimidation? Have you had a lot of people not for you? Because we're on the side of like, everybody needs this and everybody should want this when they listen. But then there's the other people that are like, oh, she's a nurse practitioner, and there's these neurosurgeons and Harvard and pharmaceuticals and all the experts. And we're going to trust this new practice that is speaking against, and I'm generalizing, of course, the quote unquote world and experts. Like, talk to us about that factor of going like, I got to open this and I'm ready for it.
Absolutely. I think what has helped is that I had a good patient following. So they knew me from before, knew what I was about. And so opening this up, they already knew that this is how I practice and what they wanted. And so word of mouth is huge. And I think that people just trusted us through the patients who have seen us. And, haven't had a whole lot of negative feedback. We do get questions around, oh, you're not an MD. How, can you do this? And yes, I can. It goes back to how comfortable you are in your training. And I've had a lot of training by MDs in traditional medicine, so extremely comfortable there. And then, did the Institute of Functional Medicine training. And so I tell people a lot of the time, we're rooted in evidence-based medicine and as much as possible. And so that helps a lot. And I think too, just people trust you when you take the time and you are committed to them getting better, and and they feel that from you. Like, they'll be like, oh, you want me to drink my own urine? What temperature? Like, what day of the week? And
They will.
It's just like, it's building that trust there with
care,
patients. And that's what I love about my team is Bethany she does my health coaching. She does a lot of stuff. But one thing I utilize her for is health coaching. And there's some crazy statistic about it's like 90% of patient outcomes are positive when you have a health coach involved.
90% of patient outcomes are improved if you utilize health coaching in your practice.
So I can review your in-depth blood work and give you a whole plan on low inflammatory diet and low histamine diet and take these supplements. But Bethany's going to kind of help. Health coaches kind of help that to come to fruition and you actually succeed. So to answer your question about the negativity, I haven't really experienced it. I think that when people come in and they're signing up for their practice, they know already what to expect. The girls give a really good rundown, and I think people just are ready for practitioners to actually care about their health in a way that they feel like you're invested in me, and it's truly just taking more time. And we do offer some more off the beaten path things like ozone therapy. I mean, it's heavily rooted in evidence-based medicine. It's been around for 150 years, and it's hyperoxygen. So it has thousands of published literature on its safety and efficacy. And I've seen that in practice, but FDA doesn't approve. So I guess even when I mention that to patients, they're just like very open to you explaining what it is and how it's helped them, and they're ready to do it. So
yeah, I would say I've only haven't experienced any negativity. It's more just questions.
Mm-hmm.
Like
Yeah.
we even surprisingly have some RNs who aren't sure what the scope of practice is for a nurse practitioner.
Right.
And so we'll have the questions of like, is there an MD on site? Do you know, things like that. Like they really just kind of want to understand more
Yeah.
what it is. Or, you know, we'll occasionally get people that drop by for a brochure and they're just like, they do their hands like what is this? Like, what do y'all do here?
Right.
And really just want to kind of dig deeper into what we do. I think a lot of the people we get are kind of at the end of their
They've tried
rope.
everything. Yeah.
They're kind of like, I've had this for 10 years. I've seen every doctor. My specialists have told me, like we had a patient in particular who was seeing GI and they were like, you're just complicated. Like when we get the people that they're
That's
specialist.
what GI told them that?
Yes.
Yeah.
Like we get
Yeah.
the people who their specialists are like, we don't know.
Right.
Like
They don't fit
this,
the-
this
yeah.
doesn't like, it's not working.
Or it would take too much time for them to
Right.
actually figure
Right.
it out.
Yeah.
It doesn't fall into their practice model.
Right. Doesn't fit in or within the time frame that they can spend with them because of the way the insurance model's set up or whatever. So we do kind of get a lot of people where they are at the point of, I just want someone to listen to me. I want someone who's going to try something different. I'm open to trying something different at this point.
And on the flip side too, we do all the traditional primary care.
Yes.
Yeah.
So if you need prescription management, if you need an EKG, if you need urinalysis, skin biopsy, pap smear, I mean, we can do the whole traditional primary care. So it's either people were their last resort or they're just genuinely want a primary care practitioner
Yes,
that, you
that
know,
thinks
has this
different.
whole other side.
Yeah.
So can you speak to some of those things that you were saying people are asking about an MD being on site? What does that look like?
Oh, yeah. So I know for some states, it's like 25 states in the country allow nurse practitioners to practice like without a supervising, like they can do their own thing. In South Carolina, you have to have a supervising physician just within the state. So we don't have to have one on site.
Nice.
As long as you're obviously practicing in the scope that you're trained for, right? Is that right?
Sounds
Not
right.
even that, but yeah, they just have to be within the state lines and have
Like
Just
licensed
available
in
to
the
call them
available
if
if
you
I
need
ever
to.
need them.
Look over your
absolutely.
charts if you needed them
Yeah.
or something. Yeah.
Yeah. So
So I think of a lot of people who have, and especially post-COVID, anxiety, depression, all these psychiatric issues. And when they go to their primary care, oh, you're depressed, here, take this. Or you have anxiety, take this. And you can't sleep, take this. And the majority, at least in my experience, of people aren't getting any other questions other than, do you feel sad sometimes? Yes, take this. Do you feel anxious sometimes? Okay, take this. And do you have trouble sleeping sometimes? Okay, take this. So I'm assuming that these people could come to you and you would start to figure out, why are you anxious? Why are you depressed? Why are you not sleeping?
absolutely. I normally tell my patients, you know, you don't have a Prozac deficiency. There's times where maybe you do need Prozac, which is an anti-anxiety or antidepressant medication, but we're going to dig into your gut health a lot. You know, 95% of your serotonin is made in your gut. 90% of your immune system is determined by your gut health. So we dig into that. Always nutrition, sleep hygiene, your relationships with people, your emotional health, the mental health. Bethany is actually finishing up her integrative mental health coaching certification.
Cool.
So that's going to be a great bridge for the practitioner. You know, you have the practitioner here and then you have maybe psychiatry over here. So she's a good bridge there. And we do utilize supplements a lot too that are rooted in evidence-based medicine. I'm thinking of saffron as one of those.
Saffron, our newest.
Saffron
love.
for anxiety, depression, and sleep. They have clinical trials that have gone up against Ritalin and Prozac. And so we utilize those a lot, but we're always looking at the whole person, the whole entire person. And
Stealth infections a lot of times.
yeah,
For
absolutely.
anxiety and depression. And
Like
things.
secret, that viral
Yeah,
issues.
like she was saying, the
Yeah.
tick-borne thing that no one had ever found in this
Yeah.
man.
Mold
a lot
all
of
the
times
time.
mold, lots of mold toxicity for people
So-
with psychiatric stuff.
Yeah, tell us about that. Like, so say it's day one and somebody walks into your clinic. Tell us about what that visit looks like and send some of the testing avenues that you might send them down.
So the first visit is an hour long, and previous to coming into the appointment, you fill out probably 45 minutes worth of paperwork. So we get to know everything about you just before I even walk into the door. Your top priority concerns, your goals for your health, everything about your sleep, your nutrition, your exercise, all of the symptoms you could be experiencing. And then I spend an hour. We go through that paperwork together. I oftentimes tell patients, you know, our new patient appointment, you bring me a 1,000-piece puzzle. We're just dumping out and kind of flipping them over. And we decide from there, typically a good panel of blood work, because usually patients have insurance and we can at least bill it to insurance. So we start with a good panel of blood work, and that's going to look like a lot of the, depending on your symptoms, but a lot of the tick-borne bacteria, different viruses and bacteria that could be reactive in you, like Epstein-Barr virus is a big one. I'm looking at a lot of different inflammatory markers. I look at a TGF-beta. It's highly related to mold, but also just inflammation. It's a cytokine marker. So lots of vitamins, minerals, full thyroid
Hormones.
function panel, hormones. Yeah, we look at the whole 9 yards, I feel like, in the first visit that we do blood work.
Gotcha.
And then we bring you back in, and we go almost another hour of just reviewing your labs together, coming up with a plan, and then going from there. So,
Nice.
yeah.
So Randy has really high estrogen, and he's really working to get that down. So there'd be testing that would find that?
Raw carrots are great
Really?
for high estrogen.
Get rid of your toxic estrogen
Yes,
that you
Some
have.
you need some
DIM.
raw carrot salad.
DIM.
So I guess in this journey, and again, I think that it's probably still fairly new. How comfortable are you guys talking about polarizing issues in the system, if you will? Like things like vaccines or birthing process, or because there's almost, I mean, I know there's some gray, but then there's also some like people on one side of the fence or the other. And like, how do you navigate that world?
Good question.
Because that, I mean, it's the world that we've lived in for 15 years. And
Yeah, the medical world almost implies to us like, okay, you can talk about this, but don't talk about that.
Right.
You're allowed to talk about OxyContin, but you're not allowed to talk about
Right.
MMRV or
Yeah.
whatever it is.
Yeah. So I try to personally meet patients where they are. So some people come in, and if your guns ablaze and anti-vax, it's going to push them away and they're going to feel judged.
right.
If I would have gone to an integrative practice back when my son was sick and they were trying to tell me that vaccines caused him to have seizures, I would have walked out the door
Right
as
away,
fast as I wanted to walk
Yes.
in. And so just trying to find a good balance of where are people at? How do we give informed consent? You know, the good, the bad, the ugly on everything. And then we come up with a decision together. And so, you know, things like whether that's a medication, or vaccines, we look at medical history. We'll look at, say the mom and dad decide they want to vaccinate their children. We go about a way that preps their immune system before. We help with some different herbal tinctures and things that help with liver support and lymphatic support after. We only give one at a time, you know. I mean, we're not bombarding with 5 at a time. And so then I feel like in such an uneasy state that we're in medicine
Right.
and on some of those topics, I do feel like we land on a really good place with our patients where they feel the most confident they're going to
Yes.
feel in their decision. And I feel confident that I've communicated to them, you know, there's risk possibly to not getting vaccines, and there's risk to getting vaccines, and, you know, everything in between. And we talk about all of that and trying to come up with a decision for them.
Yeah.
And if you're completely, you know, anti-meds, anti-vax, we want to support you in that, and, you know, no judgment.
Yeah, I
So,
love that.
yeah.
I think that's
That
what
feels-
everybody
that
wants.
feels
Yeah.
right.
Like
Yeah.
someone to just
feels
say,
like the
"Here-
right way
here's
to
It
the
just
do it.
feels
information."
normal.
Yeah.
Because here's why, and why I bring it up is we'll get patients that are looking for just medical freedom. Like, hey, is there a place I can go to communicate with somebody, get education on the pros and cons of either side, and then me as the patient ultimately decide because it's my body or my kid's body.
Right.
But we're getting people that are like, I went to this pediatrician and I can't go there anymore
Right.
because they won't allow my child there because they want to do ABC procedure. And we don't want to do that.
Right.
I hear that a lot
Yeah.
on the phone with people.
Yes.
Yeah.
And then we're kind of stuck because our licensure doesn't allow us to do a lot of things. So the way we get around it, I don't know if you should say this on the air.
He's like,
But I
hold
think
up.
it's
Probably
right.
not.
He's like, hold up, wait.
If you don't know, probably
I
not.
think it's okay.
Get your malpractice on the line.
Yeah, we may need to edit this. But I think of it like, so giving information, then saying, if you want what I would personally do. So I think of it like, so if they're like, hey, what did you do with your kid? Then I'm allowed to then say, here's why we chose this direction, but you get to choose. Like, I can't give advice to do or not to do whatever if it's not in my scope, but here's what we did. And that feels just right
Yeah.
to me.
Yeah.
It does.
But so with that, I guess, do you guys, just so our listeners know too, because they're all looking for this, are you guys more pediatric focused? Are you guys more adult women focused? Or are you just kind of open to your...
We're the most primary, like, family practice you could imagine, from 1-year-olds to 100 years old, from cardiovascular, women's health, men's health. I mean,
Mental health,
mental health,
autoimmune.
Yeah, primary care has been my love since I was 17 years old when I started working in it, and so it's just. I wanted to be able to do all of it.
That's great.
So we do.
That is
Yeah,
awesome.
we have probably like what would you say? Maybe 40% pediatrics.
Yeah, we have a lot of families
And
that
we
come in
just
where it's
families.
mom, dad, 3 kids.
Yeah.
We take care of the whole family. We've had a couple where they'll send like the dad. He's the litmus test. They'll be like, we're gonna send dad.
Yes.
He's gonna come for his first
Experiment,
appointment, and
yeah.
then they'll call in like a week and be like, I'd like to get myself and all of my children set up.
That's how we do everything
yeah,
too.
yeah,
I have
yeah.
to go in first, ask all the questions.
Check it out. Do your due diligence before we all get signed up.
Yeah.
Yeah. But I always tell people, like, we're really just pro medical autonomy and the patient provider relationship, informed consent, literally on everything we do. You're going to probably sign 1 million consent forms because we want you to have informed consent for every procedure that we do. Even if we talk about it, we want to make sure everyone feels fully educated, fully comfortable in the decision that they're making, fully supported, has opportune time to ask questions about what the treatment is that they're getting or service or whatever. And I think people like that because we have people who come and they say, well, I'm not anti-vax. Like, I think there's a stigma or like misunderstanding that if you do any type of holistic medicine that you just kind of fit into these very black and white, polar opposite type camps, and there's nothing in between. And we kind of exist in that in between of, you know, there's people who call and they're like, well, I just didn't want to give my kid all of them at one time. I wanted to space things out. I wanted to skip 1 or 2. I wanted to do, they just want a choice.
Yes.
And they're like, but they're going to kick us out. And, you know, and then they don't really get the informed consent. There's not really a conversation about, well, it's just like, this is recommended. That's it.
Right.
So I think we really cater to, like she said, meeting people where they're at, and we can understand people from all sides of that spectrum. And really work with our tools, what they're comfortable with. And I've found that the more you build that relationship, the more some of those polarizing people become more soft and more open to different things that maybe they wouldn't have. And maybe they have those defenses up because they've had such bad experiences on one side or the other before.
Yeah. I'd say we're in the same world. I mean, that's... People may think that we're anti-medicine or anti-vaccines, I don't know. Guess.
Well, we
we
are
ch-
in the sense of the way that it's
The way we-
portrayed a lot of the time.
Right.
Sure.
Everything that you're talking about is like, yeah, that's amazing.
and
Yeah.
we
Yeah.
and we live like, and then we live our lives that way. But if you were to actually sit in one of our rooms, I think we're very similar in the sense that we're looking for root cause. Like,
Sure.
where is this coming from? And then just because we may say, hey, don't jump off a roof of the building, right? That's a good idea, but it's your choice. Like, at the end of the day, if you want to jump off of that, then you just we'll deal with the consequences of that afterwards. That's kind of how
We'll be
I
here when you get down.
Yeah.
Yes, that's how I think of, like, when we do workshops or talks, and it may be things on like cardiovascular health, and it's like, well, we're chiropractors, but we look at it from the viewpoint of like, well, your brain, your spinal cord, your nerves control every cell, tissue, and organ in your body. We happen to work on that system. All we want to do is remove interference. If there's interference to the nerves that go to your heart, and we can get in there and just remove the interference to those nerves, we're not like healing your heart, but the nervous system now can send the power from the brain and control and coordinate the function, right? So we'll talk about that. And again, at the end of the day, it's like, but we just want you to also know the consequences of taking a blood pressure medication for the rest of your life, and
Right.
nobody figuring out why is it elevated, right? And or your cholesterol, like taking these cholesterol medications that literally for 2 decades, I think, have been shown to not work at all, yet your doctors are still giving you this. So we have to step in that gap to say, let's at least explore that, so you know there are other things you can do, right?
Right.
Definitely. So I have a question about weight loss, because I think Ozempic is probably going to be terrifying at some point. Everybody's all of a sudden on it, and they're losing a ton of weight. And then I have my friends who are, one is a CRNA, so he's putting people to sleep for a colonoscopy, and saying people are getting full stomach syndrome from, like, they're aspirating and they haven't eaten anything for 4 days. So now you have to be off it for a certain number of time, and it supposedly it paralyzes your stomach. I don't know all the details about it. But I'm curious for a person who's, let's say they are gaining weight, they're not sure why, and I hear this all the time. They're barely eating anything, and they're still gaining weight, and they know their hormones are out of whack. Sometimes their quote unquote thyroid came back normal, and they don't know what to do. What does that look like in your world? Because I think weight loss is a big thing right now that people
Always.
are looking for.
Yeah. So I actually do, we have compounded semaglutide interzepatide that we give in a select few,
Yep.
amount of patients. And it's my big fire truck hose to put out the flame in the beginning. I can give you berberine, and that's like a squirt gun on the fire. And the risk of these medicines are really when they're continuously given for 1 to 3 years or more. And we're so incredibly strict with these. You have to come in every single week and get an update,
Love
get
that.
your vitals, get
Yep.
your weight. We have you on a whole plan, digestive enzymes, nutritional support, all of this to make sure. And we want you on it the least amount of time as possible. So it's, someone with an insulin level that's through the roof, that they truly are trying everything to get their weight down and to eat healthier and to exercise. And it's just their insulin receptors are just being lazy. So it's not working like we want. And in the meantime, they're in this roaring flame of inflammation, of, high blood pressure, high cholesterol, and, insulin resistance and PCOS for women. And it's like, man, if we could just utilize peptides that are already in our bodies in the appropriate way, that has been shown to not just help with weight, but to help with total body inflammation, autoimmune diseases. It's helped with neuropsychiatric conditions. Man, why would we not use that? So
Right.
we use it short term, 3 months, maybe 6 months.
Yep.
to
Which
be-
is the normal way to do it.
Right.
I don't think most people are doing it that way.
No, absolutely
It-
not.
It
They're
seems to
not.
me like a lot of people are just taking it all the time.
Yeah, and they're not
For
getting
long periods of time, no lifestyle change, no monitoring.
absolutely.
Yeah.
They're not getting they're not getting monitored
They're
as
doing the
much.
online clinics or whatever.
That,
where they
I'm hearing
just-
about that a lot. Yep.
Yeah, and we've like developed a whole protocol. Like you have to come do a consult first. We check labs to make sure your organs are functioning, and then you're getting that weekly check-in where we're literally checking your vitals every week. You're getting messaging, like support. You can chat back and forth every day if you need to. And I think a lot of people utilize it incorrectly, like with what they were talking about with the stomach being full. They're still trying to like eat in the same way that they were before when they weren't taking it, and not supporting their digestion. They're not hydrating well at all. We have like a liquid, like multivitamin that's like, it has over 200 ingredients with herbs and all these things that really helps like fill nutritional gaps. And it's a whole different experience. And it's like she said, the lowest dose possible for the least amount of time possible. And the amount of people that I see weekly that are like, my brain inflammation feel like like my ADHD symptoms, my brain fog, my autoimmune stuff, like people who've been diagnosed with fibromyalgia that have like chronic debilitating pain from the legs down, or like my pain is like a 1 out of 10 with these peptides. Yep. So there's like a lot of other benefits, but I think it's just all in the like pop culture and the like extreme weight loss with like we are like honing in on prioritized protein. Like we want you eating a lot of protein first before other things. Still like weight training and, building muscle mass. And so I think it's a completely different experience than I got it online from like a telehealth. They just sent it to me. I'm just taking this and, no kind of time limit on it. We're not looking at labs. We're not...
And educating
we're not educating about it.
Educating on the evidence that's there and what we see clinically. I started writing it years and years ago just for diabetes. I'm like, well, why are you coming off of your thyroid meds and your autoimmune conditions are going in remission and you're coming off your depression medications? Wait a minute. So yeah, I think it's just doing it the right way and the safest way.
That makes sense. So if somebody's been on it, I'm sure, because I know there's a lot of people on it, there's shortages of it. They could come to you and say, I've been on it for a year. What do I do now?
Yeah, absolutely. Yeah. Honing in a lot on the nutritional side. And then there's a lot of natural supplements that are helpful for weight loss and balancing hormones and things. So.
Yep.
I see a lot of people on the, like where she was talking about the integrative health coaching side. And I do have like a focus in mental health there. A lot of people, who may have been trying to do all of the lifestyle modifications and things like that. They've got the rampant levels of different inflammation. They come back and they go, wow, I didn't realize the emotional attachment that I had to food.
Right.
And like the food noise is what, I don't know if you've heard that term where your like brain is constantly thinking about food. What am I going to eat next? When am I going to eat? Because their digestion slowed down a little bit. And they're not able to just kind of force themselves to overeat, like whether that's emotional comfort or distraction or whatever, they kind of have this big realization of their relationship with food. And then we're able to utilize the effects of them being on this medication to help heal that relationship with food so that they're producing long-lasting lifestyle changes once they come off of it versus utilizing it as kind of a shortcut, or some people say easy way out. Like you still have to eat right and exercise. And it kind of gives people this break from their brain of maybe these decades long poor habits or like emotional connection to food and things like that. So they're able to heal that and kind of process through that. And then that helps them have those long lasting lifestyle changes and keep the weight off.
So similar then to how like depression medication, if someone's suicidal, they may need that right then, but it doesn't mean they need to be on it for the next 50 years.
Exactly.
Right. Yeah. Yeah.
Do you guys have any general health tips that just if people are listening, it's like just let's start here without ever even meeting you?
Water. Drink your water. So many people are dehydrated, and that's just so much of their truly fatigue and lots of things, headaches and muscle pains. So drink tons of water, add in your electrolytes at certain points in time. prioritizing your sleep,
Sleep hygiene. That's what I was
sleep
gonna say,
hygiene,
is huge.
exercise, even if it's, and that can feel intimidating, especially for parents of young kids and full-time working. And when do you do that? Just trying to get out and do something a few days a week.
I would say, let's see, we hit sleep hygiene, hydration. The electrolytes is most people think they're like, I douse myself in water. And it's like, well, you're getting no minerals
That's
at
Randy.
all.
Randy
You're just,
Randy pees
No,
a lot. He pees a lot, so he doesn't even get to stay
But
hydrated.
I drink a ton of water. What do you think for the amount that you should drink? I've always heard half your body weight in ounces is your minimum.
I think that's a good place to start. I drink a gallon a day, but I think that's a good place to start.
Yeah. How many ounces is in a gallon? Do you know?
128.
Oh yeah.
Oh, that's
That's
a
a good
lot
amount.
for you.
Mm-hmm.
Unless you're 250 pounds.
not quite.
Yeah. I drink a lot of water.
Well, and why I bring that up is because you hit on the main two things that people can easily control and just don't. Meaning you don't need a health expert to be like, hey, are you drinking enough water? Are you getting enough rest? Those are just fundamental before we get into like this specific supplement or this specific exercise routine. And just pure movement of the body.
Absolutely.
Nowadays, though, are you guys seeing a lot? I just listened to a podcast on light and how important light, water, and magnetism is, like just grounding and that kind of thing. And it kind of blew my mind on how powerful sunlight. I mean, I knew it was, but the dangers of sunscreen. And again, it's always what are most people doing? Do the opposite, right? It's like scare yourself about the sun,
Right.
and then cover yourself in poison.
Right.
So
Let's kind of
right.
That's
come
where
to the-
I just
to the
think
middle
on
ground.
most topics we're gonna fall in the middle
Yeah.
of most things and reason with both sides.
Yeah.
I love grounding too. We use grounding sheets on my kids' beds.
Yeah, same.
But yeah, grounding's a great one.
sunlight
yeah.
first thing in the morning and
Yes.
sunlight right before, like in the evening,
Even using red lights,
Right.
changing your light bulbs out to red
Right.
light bulbs.
which we have
At-
red light
at-
therapy.
Yeah, at bedtime, that can be helpful too, and producing more melatonin in the brain.
Right.
That's a pretty easy fix that you can do there too. So
Because we just added a laser within the last year to just some of our treatment protocols, and it's I was skeptical just because I'm like, what are we like? You're just waving a wand on somebody.
Is it red light?
So
or what?
It's a class 4. It's made by Sumis laser that basically penetrates a certain amount and it decreases inflammation.
Oh, okay.
Reoxygen.
Okay.
It's pretty wild the results that happen with a focused light therapy. And then, to expand that, then, you look at the red light therapies and all this stuff with the sun. But the podcast was talking about like this, how important the sunrise is and just getting your rhythm based on like the sun, and how a lot of what we eat doesn't necessarily matter if we can get the mitochondria and the light that's happening in the body to just be efficient. And they equated it to like your engines need to be correct before your fuel, before you like change the fuel. I was wondering if you guys have found or used a lot of different therapies, like light therapies is one of your more primary ways to treat people or help people.
yeah, I'll normally, especially if someone has insomnia, significant insomnia, and one of my kind of treatment plans for them is as soon as you wake up, try to get out, get outside, get your feet on the ground, in the dewy grass, get some grounding in, and then eat now this depends. I do love intermittent fasting for a lot of people, but sometimes when I'm trying to reset the circadian rhythm, getting out in the first light and then eating a low carb, just fat protein breakfast.
Yeah.
And that typically, over a couple of weeks of doing that every single day, your body starts to reset that circadian rhythm. So, yeah.
We use red light therapy too for like targeted, like over your
Yeah.
thyroid if you've got like certain disorders or things going on in certain parts of the body.
So let's tell the listeners, what are all the therapies that you guys offer at the clinic?
So we do all the different ozone therapies. So IV ozone is your most potent, most systemic form of ozone therapy. And then we do rectal and vaginal ozone therapy. Those are also systemic forms of ozone. We do ear and sinus. So that's really helpful for symptoms are, collarbones and up, allergies, colds, things like that. IV nutrient therapy, like high dose vitamin C, glutathione, B complex, B12, all of that, Myers cocktails. So essentially kind of like an infusion clinic. We do microneedling with PRP, which is we use an FDA cleared skin pin for the skin, and it's as effective as Botox in many studies. But you use your own plasma out of your blood.
Sweet.
You spin it down, and then you can use it as a serum, and you use this tiny little micropin needle. And it actually increases your elastin and collagen by 400%.
Wow.
Can use it for hair restoration also.
Hair restoration.
So for people experiencing male pattern baldness, or also for like ice pick acne scarring, like the really deep scarring. Facial scars are just scars in general from surgeries or things like that.
If
It
you
works
wanted
really
more,
well.
like say Randy wants
The
more
natural
chest
approach.
hair, could he like
We-
microneedle his chest?
It will not make hair grow more on an area where hair doesn't already
Right.
grow,
Okay.
but since hair does grow on the chest for men,
I wouldn't
could
want,
get you a full
I get way
Austin
too much
Powers.
hair. I got way too much chest hair in general.
oh, you forgot, she does ozone joint injections. So
do.
Oh, really?
prolozone is what it's called.
Yes.
So those are really, really effective. We actually got trained in Austin, Texas for all of the ozone therapy by some really great doctors.
I mean, I've had some of my best experience with prolozone injections are in the knees. So osteoarthritis in the knees for years and years, and they are like, I don't need my cane now. What in the
Right.
world? So that's been really cool to see.
How long do those last for? Is that like or it kind of depends?
Yeah, it depends. I mean, I've had super, very chronic osteoarthritis, and my last lady she needed one, and she went several months without needing anymore. So
That's the very first time I heard. I think, is prolotherapy the same thing? Is it
Yeah.
that just short for it? I remember it was probably 15 years ago. I was sitting on an airplane, and a lady was telling me she was, and I was either just graduated or I was about to graduate chiropractic school, and she was telling me that she was flying from wherever we were to this clinic that does prolotherapy and was
Wow.
so excited about it.
Yeah.
Said like everyone in her family, because it wasn't available anywhere.
Right.
Everyone in her family was just one at a time individually flying there and getting it done.
yeah.
I wonder if it was Dr. West Clinic, one of the doctors who helped train us. He has a clinic out in Idaho. That
Yes, I think it was
he-
Idaho. I think it was
it?
Idaho.
It
It was
was
Idaho,
Dr.
or
West.
it was
He treats people who are like chronic Lyme or like literally like on
Yeah.
death's door
Yep.
with chronic disease. And he actually was the one teaching the prolo therapy and has been doing IV ozone for like what we're doing now for 15 to 18 years, I think. So I think it was more the West Coast kind of is ahead of us sometimes in the like holistic therapy realm. So yeah. And then what are some other
We do
health coaching. So
coaching.
integrative health coaching, weight loss injections.
Tirzepatide.
Yep, and they're the compounded forms that have B12 in them, and they're like through a great pharmacy. I know
Yeah.
people are worried about ingredients, and all of this stuff that we use is very clean, preservative-free IV nutrients. Because I don't know. I'm sure y'all probably know all the MTHFR stuff, but like methylated B vitamins are totally different than the non-methylated. So everything we use is methylated, and vitamin C often has like lots of allergens in it, like corn, and so all of our stuff is really high quality, clean stuff.
We do in-house labs. We have a full lab and lots of supplements.
Nice.
So yeah,
Let's talk weird stuff like
I love weird stuff.
like parasites, heavy metals, mold, genetic testing, like all of that world, because I think the common folk just doesn't think about that. They think like, oh, I go to my annual physical, I get blood work, everything looks good, And that blood work is just basically a snapshot of not much in all reality.
Right.
What sort of testing or what sort of things should people do to look at things like parasites, mold, the hidden viruses?
I do muscle testing, applied kinesiology, so I'll sometimes, bring that in. It's a tool in my toolkit because it's free to
Yeah.
do that. You don't have to pay for $500 worth of testing
And
or
can you
more.
describe that a little bit for the listeners? We know what that is, but what does that look like for a person who doesn't know?
So essentially, we're all energetic beings, and I'm assessing in the same way that I would assess your deep tendon reflex in your knee. I'm actually not testing your knee, I'm testing your nervous system and your neurological response to that stimuli. And so with muscle testing, there's many different ways you can do it. You can do nutrition response testing, where essentially, you can test to see if someone is sensitive to certain foods. And I use the deltoid muscle when I'm doing my muscle testing. So I assess to see if there's weakness in the deltoid muscle when I put certain foods on you, or certain pathogens like parasites, heavy metals, tick-borne, mold. I mean, you name it, you can really muscle test anything. And then you can see which supplements or things would actually bring those areas strong. And so, I'll use that. I think that that's a good tool. Parasites, I think we all probably have parasites, and they can serve a good function. However, whenever there's, chronic disease and things, it's good to do a parasitic cleanse because we're not always going to find those things on labs and stool tests. It just doesn't always show up. So a lot of different protocols gives us a good parasitic cleanse. That's what I love about rectal ozone, is that it's also anti-parasitic. So, and within 5 to 20 minutes, it goes systemic throughout the rest of the body. So,
Randall, you do some rectal stuff. What is the?
I never have, but I would. We had a couple. We had a couple episodes where they were talking about coffee enemas, and we had two friends that were using the
wrong
vaginal. They were using the wrong tip
in the rectum.
Oh no!
Yes.
oh no.
Yeah.
This is much less involved than a coffee enema. So if you
seems
could do
easy.
that, it is
Yeah.
really easy.
Yeah.
Yeah, rectal ozone, super easy.
So I want to talk about testosterone a little bit because I love talking about it. I don't actually have really high estrogen. I don't think, but I haven't. I don't know. But I love all this stuff about how to increase your testosterone naturally. But I'm seeing a lot of, and I don't know if the word abuse of it is right, but I think it's the same way that I look at Ozempic, where there's just these online clinics just mass pumping it into people without any oversight or understanding or knowledge, or bodybuilders who want to, their testosterone be 1100 or 1500, and then when they go get tested the original time, they were at 200. So where does that conversation go usually? Say somebody comes in, I don't know if I have low testosterone, high testosterone, because the guys that I talk to who have low testosterone and then they get tested are like, this is the best thing I've ever had in my entire life. They're like, even if my life is 20 years shorter, I don't care because I want to live like this until I die, and I'm willing to do it. And so there's something about it that I think if somebody has really low testosterone, a male has really low testosterone, they're just so miserable that they'll do almost anything to get it high, but they don't really know who to turn to or what to do.
Yeah. So there's been many times where I'll test testosterone in young guys, in your teens and 20s, and it'll be plummeted. And so we have somewhere to start with. And typically, weightlifting is recommended. Weighted squats are shown to improve your testosterone. Nutritionally, we always do a nutritional route, whole foods, lots of fiber, lots of protein. There's different supplementation. So we're not always going straight for the testosterone or even the bioidentical testosterone. It depends on the age. I mean, I've had 20-year-olds with a testosterone in the 100s. Wow. And we did a detox on them, included heavy metals, parasites, and after checking it, it was in the 900s, through a detox of the toxins that were in their body. So,
So if they didn't come to you, they probably just would have been put on testosterone and taken it for the rest of their life.
They probably wouldn't have ever been tested because they were in their 20s, and they would have continued having
Like
depression,
fertility issues possibly.
Yeah.
fertility,
Yeah.
Lots of
And never know.
depression. with
lots
men
of
with low
mental health
testosterone,
issues, and just fatigue, and it's not just the sex hormone that inhibits sexual function. It has to do with a lot of, and it's a cardiovascular marker. I mean, if you have low
Right.
testosterone, you're at higher risk of cardiovascular disease. So just
Does the libido stem from Designs for Health, does that help with the test? Okay.
yeah,
We have a supplement in office. I
just
just
horny goat weed in it.
Boom.
libido stem M and F for male and female. So
Nice.
yeah.
So, but I always was told like you should put cold packs on the male beanbag to help increase.
Cold packs? Like a ice pack?
Yes.
Okay.
Yes.
I always thought that was
ice.
bad for it.
No, that I think
Great for it.
yes.
It
Have you guys
sounds.
heard of
I mean,
that?
it sounds
haven't,
terrible.
actually.
I mean,
Probably not evidence based, but maybe I thought I think in like other countries
well,
that's what they're
Really?
doing. With
it's
their like
the opposite concept, I guess, if they say like the whole, if you're wearing like super tight underwear that
Yes.
keep it really warm, then that's like negative. So maybe they're,
yeah, if it's too
the
hot.
idea is that we're
Yes.
going to
If you could
cool it down.
if you could
there.
cool it down quicker.
Cold plunging for the beanbags.
Yes. You might want to add a cold
To our
a
protocol.
cold plunge beanbag option
Option.
at your clinic. Just a little cup
in
of
the
water.
back.
I mean, we have a friend that just finally quit wearing tighty whities too.
Yeah. It was
I
a
don't-
journey.
I feel like
Bless
that's
his heart.
was a thing, and it might be coming back. Now.
Do your husbands wear whitey tighties?
No,
God,
no,
Yeah.
no.
Good for you. You could tell.
Scientifically based? No, we don't let them.
No.
Now, and with the hormones too, if you get put on hormone therapy, shouldn't it only be for 6 months? I was told like if you mess with hormones at all, these people will feel incredible, and they're like, "This is magic for 6 months." Then it starts to taper, and then it's chaos.
Yeah, your body kind of stops making
Yes.
the hormones. So I'll use it if someone's really in the tank. I'll use it as a starter, kind of like lower dose. Let's get things going. Let's get you feeling better out of the weeds so that you're actually wanting to exercise and
Right.
do the things. I find that that's helpful a lot. But yeah, if you start a 30-year-old guy with low testosterone, he's probably going to be on it now forever. And then when you take him off,
It's going to be a mess.
it's going to be a mess.
Yeah, because there's so much. I went to a seminar. It was Standard Process. That was the supplement company. And they talked about how the way hormones work, they're not, it's because it's like parts per billion, something like that has a massive effect on the body. And so when they're dosing people and it just turns into this, like you're not checking very regularly, that they equate it to like a 6 mile long train car filled with popcorn in like each thing, that by adding one kernel to the train, it would affect that amount of the cells in the body. So it was like, wow, that
Wow.
little bit of parts per billion change, nobody's really looking at that closely. And they were big proponents of saliva testing for hormones because it's a better snapshot, especially for cycling females, because during that 30 days, if you get your blood work on whatever, day 4 versus day 17,
Yeah.
could be completely different.
Yeah.
Which we're super hormone focused. Like
Yeah.
for females, that she pretty much will only order labs for them like
Day
between day
21.
19 to 21 of their cycle,
Gotcha.
in order to get a more accurate
Good. Yeah. 'cause
vision of that.
that's
But
nice.
do we still have the saliva tests? That we
Yeah, I do
in
saliva
office?
testing. I try not to go towards those more expensive
Right.
out-of-pocket tests
Right,
right away. So I usually can get an idea on the blood panel, and then insurance typically covers it.
Yeah. Nice.
So
But we
What-
have stool testing and urine
In
mycotoxin
the clinic?
testing.
You
Yeah.
just go right in the clinic? Really?
well, we
Oh.
can give you the kit.
We give you the kit. You don't.
You guys aren't catching it.
We're not. No clean catch for the stool in the
Eat
office.
a big meal.
But we have the tests for you to take
Yeah.
home.
And
And
those
do
are
in your
pretty-
own timing.
Those are super powerful, right? Like that's where you learn about the entire gut.
Oh,
right
yeah.
there,
Yeah.
right?
Like 20 pages of information about your gut microbiome.
Is that the most effective like gut test, would you say, as a stool test? Or is there something you guys like better for gut health?
I love the gut test, the stool
The
analysis.
GI, is
The
it like
G-
GI effects from
GI 360
something?
or GI map? Yeah.
Yeah.
I really like those.
Yep.
Those are good. We have food sensitivity testing too that we'll do, but honestly, I normally start patients off on a low inflammatory diet, just to
Just
start
good, yeah.
with, and that's free.
We have
Right.
pharmacogenetic testing too. So I don't know why it's not more like standard. I think it should be standard for anyone getting on any type of pharmaceutical, but
Right.
it just essentially lets us know what's going on in their body genetically and what they're going to be prone to either metabolizing well or a medication that would not work well for them.
Right.
So if we do have to utilize pharmaceuticals, it keeps us from having to do this typical trial and error, try
Prozac
it,
for 6 weeks.
and then a bunch of crazy symptoms, and then it lets you know kind of right away, this is in the green, this is in the yellow, which means you may have to adjust dosing, or this is a red, like poor metabolizer, not good, probably going to have lots of side effects. So
Yeah. I think it just brings to, like, sitting with you guys just brings to light more of the, like, when you got, well, I guess when you were in the clinics, it was just checking boxes, it feels like. And that's still to this day, when you go to a clinic, I just got in a car accident, ended up at this place, and literally there wasn't even a doctor. I think there was one nurse on site, and then it turned into nobody even touched me, which I'm not big on touch anyway, so it's nice.
you're a chiropractor.
Well, kind of.
Oh.
I like I have a degree in
sort of.
chiropractic. Yeah, I have a doctorate in chiropractic, but so I stopped adjusting years ago
Oh, okay.
because I realized I don't like touching people.
Oh, what about, could you just not use the
yeah,
the
yeah, I did a lot.
activators?
I did a
Or
lot.
is that
of
what it's
too.
called?
Yeah,
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 it's called the
Okay.
activator.
Okay.
yeah.
Using
So
his
now
laser.
now we
from
have
across
people
the
that do
room.
it. I shine flashlight at people from a distance. But I realized like they just needed to check a bunch of boxes to get me in and out of this place, and nothing. It didn't matter anything I filled out, any of that. So what I like is you guys are customized healthcare, which is what it should be. And what I'm worried about, and I want us to help with this, is there's a rate limiting step that we need, like this is going to grow. You're on Columbia's hottest podcast, sexiest,
Yes.
fastest growing. Yeah, I mean, people just say
We're
a
in the
lot
right
of, there's
place.
a lot of adjectives they use for us. This is going to grow very fast. And you guys have probably already noticed that. How do we help make more of you guys? Or what do you guys see like next? Because I don't know if you've hit capacity yet or what those numbers look like for you to hit capacity. But once this thing drops, my goodness, you're going to need me there shining flashlights
Flashlights.
just to distract
We'll
people.
put you on the in-office stool test.
Yes,
You can do that.
I'll be the catcher.
The
God.
beanbag ice bags.
Yeah.
It
I'll
was,
do the
it was
beanbag.
so serious for so
I
long.
know, I got too serious. I had to break it
Yeah,
up.
break it down.
Yeah, what do you guys know, like the number of people where you're like, all right, we need another practitioner, we need another location, we need another whatever.
We didn't realize that we would need to be thinking about that so quickly,
Right.
but I mean, just to put into perspective, I guess before we even opened our doors, we hit our year projection. So, to answer your question, I think that we're starting to think through that.
Yeah.
Like, what does that look like? What do I want to bring someone else on? Do we just cap it for a while? I don't know. I do like to teach, and I've had a lot of students with me in the past, and so we'll see. We'll
Yeah.
see. I don't
Yeah.
know if I can take that on right now, but yeah, I don't know. It's ever changing, and we feel very thankful and for where we are, and trying to we have to pump the brakes a little bit right now because we didn't know what to expect.
Sure.
But yeah, so
We've had a lot of people coming in there like, y'all are going to need another location
Yeah.
soon. And we're like, we've been open for a month. We've had
Well, it's
so
no
many
joke.
people say that. And they're like,
Yeah.
I can just see y'all growing right on.
Well, when we
into
first,
another-
when we first saw you guys open, we just knew, all right, there's gonna need to be 20 of these.
Yes. People have been begging for this.
No.
Yeah.
Someone who just listens to them and then follows what would make
Yeah.
sense for
Yeah.
that person.
Yeah, we have thought about a second location, but again, it hasn't been. This is all very kind of new. We've only been open this is our 8th
Yeah.
week, so
8th week.
Yeah.
Isn't that wild?
yeah.
That is wild.
They need Two Handsome Men LLC to help
yeah,
to help
Yeah.
multiply
Help out.
this.
yeah.
So I had a question about this too, just on the mental health, because I think placebo is a big thing, and like one of our core values is just like or our mission statement is giving people hope. And I used to joke, like when I wasn't really touching people anymore and I was still in the clinic and just meeting with them, that just through that interaction of giving people a belief in the fact that their body's designed to heal and giving them hope that they're going to get well. What percentage do you think that occurs in just like when you guys sit and think? And that's what it was. It was like, I'm here to listen and care about you and give you some steps and strategies. And just that little bit, I told Randy, I was like, you don't even need to adjust them because
It has. I mean,
I
it's
he-
doing all the- I healed them
I
already.
healed them on the first.
yeah,
the
it's
first
incredibly
visit.
powerful. Yeah,
Right?
Yeah, it's incredibly powerful.
Yes.
I mean, as much as I want to believe that you're
Ashwaganda's doing something.
right, like you're
And it is.
5 years of chronic constipation is fixed in the first week.
Right.
Like a lot of that has to be them just trusting in it and believing it and carrying it through, and I can say that about, I mean, mental health and all of this. You had a sweet little girl, preteen, came in and she was sitting across from me and just all of her eyebrows and eyelashes were gone and all of her hair was gone in her, like, part of her hair because she has trichotillomania, and they were trying to figure out why this was going on. She's heavily dosed on an antidepressant. I mean, more than the dosage you would give for a
Right.
grown man.
Right.
And saw her for a follow-up today, and she's all of her hair is growing back, and just like she's happy and she feels good. She's like, I don't
Right.
even remember the last time I poked my hair, pricked my hair out. And yes, we did find some things that we were addressing, but I do think a lot of it too is just she felt heard finally, just at, okay, you're taking me seriously,
Right.
That's why I love the aspect that I get to add
Yes.
to with the health coaching, because that mental health part of it is so big. Like, I'm sure being chiropractors, y'all hone in on like the nervous system and how it affects different
yeah.
parts of the body, but it really is a huge factor into people's healing, which is why it works great alongside with what she's doing, because I mean, you can
Heal them
you can
on day one.
shoot down ashwagandha all day long, but if you're not addressing all of the emotional
Right.
stuff, if you don't feel seen, heard, safe, those are all fundamental human things that people need to thrive.
Yeah.
And just in general, like your digestive system is not going to function properly if you're in a chronic sympathetic state in your nervous system. So that alone, just people feeling the relief of, this wasn't all in my head. This isn't just how I'm supposed to feel. Somebody believes that they can help me. There's hope that I can get better. I had someone in a coaching visit just kind of look at me and was like, am I being dramatic? And just me kind of holding space for them and letting them know that, like, no, you're not being dramatic. It was just like this huge
Relief.
cry and like relief of, okay, like being able to tackle that emotional aspect.
Yes.
A lot of people who've been sick for a really long time, they don't have hope. They come to us and they're like, I want this to work, but I don't know if I think that
Yeah.
it will, because nothing that anyone else has done has helped me. So I think a big part of what we do is restoring that hope in people,
Right.
and supporting them emotionally. One of the things that really I have a super hard time with is when people will come in. We hear it all the time, mostly with women. The doctor told me I'm just anxious, and that like makes me so upset because first of all, like if you're anxious all the time, your quality of life is pretty rough. Like it's not a good time. So writing things off as, well, it's not that big of a deal. It's not a heart attack. It's just anxiety kind of thing. And it's like, but living with anxiety is debilitating for some people. And so just being able to tackle the mental health aspect of things and kind of connect all of it and make it make sense and make people realize that it's not separate. Like your GI issues and your anxiety and your sleep problems and your emotional distress and your relationship with your spouse and all of that is a huge component into getting you well. And if we only hone in on one of those areas and don't address all the other ones, then we're not receiving the most out of your healing. So I think we see a weekly people just like, thank you so much, just relief, like just so grateful, so thankful, and just like excitement. I think it's kind of helped restore their excitement and that they can get well and that they can feel better.
Do you guys ever, so when you're on Instagram, like just flipping through stuff, do you ever see stories, like especially when you were mentioning seizures with your child, of like just people dealing with the same struggles and knowing that you have or may have the answer and like connecting that to them? Because I see fundraisers and I see all kinds of stuff, and same with in our space where it's like, man, I wish they just knew. And where's the boundary of like just firing a message at them? You know what I mean? Like, how do you handle that, or what do you do when you see that kind of stuff?
I'll either see it or someone sends it to me, and I respond with, "Hey, if you can make it to me, let's have a consultation." Or I'll direct them, like, are there any functional medicine practitioners near you? That's who I would see.
Yeah.
And maybe ask for XYZ to start with. So.
Because it's got to be so hard to just, when you hear about the amount of seizures and there's zero hope in the medical world for that. Absolutely none.
Yeah, I used to, and I think earlier in practice, I used to really like go after those people. And I realized at some point, some people don't actually want help. They just want to complain, which why am I spinning my wheels for people that don't want to get better? They're kind of like being the way that they are.
They have to be an active participant.
They have to
for
want
sure.
to.
They really have to want it, and we have to like work together. Because I think just there can be you can wear yourself thin with people kind of like trying to navigate those boundaries. Like, I want to help, I want to give resources, I want to make myself available, but then there are situations where people really will take advantage of that or take it too far, or
I used to play basketball, so I oftentimes tell my patients, I'm going to pass the ball back in your court now, and now we're going to give you all the tools, but the ball's in your court, and you have to kind of do your part in your healing too. So it empowers them, I think, to take control of their health. It's not just somebody writing stuff for them to get better. They have to actually take control, which I think helps them.
Yeah, and I'm able to help them with some of those like limiting beliefs that they may have or underlying mindsets where they're like, I know I'm not supposed to eat or do XYZ, but I don't know why, but I can't. Like I have this like blockage of like, I've got the plan, I know what's wrong, so there's a sense of relief there, but now actually being able to walk that out, what that looks like in my life, I'm not sure why. And so sometimes we can help get to the more emotional blockages there. Someone's diabetic and they need to eat a certain way for a certain amount of time or need to avoid certain thing. Maybe it's not the food that they're having a hard time with. Maybe it's the connection to family and friends that they relate to the food and they don't know how to keep that without giving up the food, if that makes sense. And a lot of people, these are very subconscious
Yeah.
like a lot of our behaviors are due to very subconscious things
Inner
going
child.
on. Yeah. Yes. Inner
Yes.
childs. So that kind of helps
Maybe
the
inner
outcomes
child.
improve.
I don't know.
Randy doesn't like any of this, that kind of
I don't- well, do you know-
thought. Like, I like astrology too.
Okay. You don't like,
doesn't.
He doesn't like inner child
you don't like
stuff.
therapy?
He
Are you like
doesn't like-
anti-therapy?
You know what? I think therapy is probably good for women, and I think it fails a lot of. And I
Oh,
think
God,
no.
he said
and I
it.
think it fails a lot of men in the approach, or maybe I said that wrong, but I think like
For sure said it wrong.
therapy is like talk about your feelings, which I think what I'm seeing in the world is like men, if they were doing something, can talk about it in a different way. So I think.
Have
I
you
don't-
read the book?
I don't know
Bad
where I'm
Therapy?
going with it.
Have
No,
you read the book?
no, I haven't.
My husband just read this book, Bad Therapy, and it's kind of along this line of, which I haven't read it yet, so I can't really speak too much to it. But
That's all right. We do that all the time.
Yeah, but I don't really know
I don't know.
anything.
It just
about
reminds me of that, that mindset of like
Yeah.
how are we allowing people to wallow in their stuff and not helping them
Yeah.
through it, or I don't know, this whole concept. So yeah, it's just I kind of understand where you're coming
Yeah,
from there.
just a different way maybe for.
Yeah.
I think men probably express their emotions differently than
Oh,
women
for
do.
sure, yeah.
So to have like the same approach for both men and women in the therapy world,
Yeah.
feels like it's missing a portion of people.
I'm a huge, I love therapy. So I'm going to be on the other side of the
Yeah.
spectrum of loving therapy. I think men don't seek out therapy as often. So, and a lot of their mental health things do go under the radar because it presents differently than women. So I'm just,
so that I agree with. And
depression
men are
in
committing
men looks
committing
like
suicide,
anger
all-
usually.
yes.
So if you see a man that's very short tempered a lot, angsty, like that's often not an anger problem. They're depressed. And it doesn't always look the same as a woman who the depression's going to kind of be more obvious. But I agree that like cognitive behavioral therapy has limitations. So if you're dealing with trauma, talk therapy is not going to be effective and not really going to work. So utilizing more holistic therapy where they do like EMDR or DBR, where it's kind of addressing
Yeah.
the root of the thing because
Can you talk about EMDR? Because
yeah,
anybody that I find who does that, they're booked up forever.
yeah,
Like I know a few people I know them and
Yeah.
they're like, yeah, I don't. I'm like, hey, I've got some people. They're like, nope. So I'm
They're
like, can I put them on a waiting
I can
list?
see.
Nope.
Oh.
Is there ever going to be a spot?
Probably
Nope.
not. Yeah, so EMDR targets the basic core schemas that we all have. So, like going back to that inner child, we all have core beliefs about ourselves that were formed at some point in our life that most of our behaviors we make choices and behaviors based on those. So, like a very common one is I'm not good enough. So, you may think that your particular issue or thing that you're upset about or angry about with somebody was this, when really it's just stemming from the I'm not good enough belief. So EMDR basically helps take you back to that particular first time that thing happened, and it uses bilateral stimulation. So like bilateral eye movement. So often making your eyes do this or holding buzzers in your hand that vibrate back and forth. And basically the practitioner who's trained in it helps you to file away that event in your brain where it should have gone, where it
Bury
didn't
it
go
deep.
because it was traumatic. And you're able to remove the trigger, the
Yeah.
buzzword of being triggered.
Yeah.
You're able to remove that trigger so that you can move forward and not be experiencing those thoughts and feelings around certain events based on the initial time that it happened. So instead of just talking about the same thing over and
Yes.
over and over, we're kind of hitting like the core of why this bothers me and why I react this way, desensitizing, reprogramming it in your brain, and then you're able to just kind of be done with that and move forward versus
That sounds great.
talking about the same
Do you
thing.
know where would people find that?
I love Corazon Holistic Health on Main Street. They're Kim, Melanie, and they have a new therapist. I can't remember her name at the moment, but they're all trauma-informed therapists. They're all trained in EMDR, DBR, which is deep brain rewiring, which is something similar. They are amazing. I don't think they have like a crazy long wait list.
Yeah, that's good because I haven't heard of it.
Yeah.
what
Oftentimes that
about-
works well for men because men are just like, why are we gonna like? I don't want to.
Why are we bringing
I talk
this
about
up?
it once. My husband's
think
like,
we're the-
that's done. We've already talked
We already
about
did
that.
that. Yeah.
Yeah.
I think we're the opposite, where we think we're way better than we
We are.
actually are. Like I was telling my wife, she's like, you know, when you have those feelings, and you're like, oh, I just as a parent, I fell short. Just eating, I just fell short, and I just don't look how I want to look. And I was like,
No.
I pretty
have
much go
none
to
of
bed.
those
I was like, I go to bed every single night being
crushed
like,
it today.
just when I thought I couldn't get better as a dad, I just had today.
We talk about this all the time.
Yeah.
We're like, we wish we could be the level of like unbothered that our husbands are. They're
Yeah.
just like, oh, like, yeah, just it is what it is. Move on. Like,
Right.
That person didn't like you today, so what?
yeah,
Right.
A
They'll
million
start
other people do.
100%.
Keep
You're-
going.
you're
Their
right.
loss. It's their loss.
yeah, right. I'm like, oh my gosh, I'm gonna think about that for 3 weeks.
Yeah,
It's
you're
like I've already filed that away. Like, doesn't
just like
exist.
the difference between you're like, you go to your husband like, hey, how do you think that went today? They're like, oh, 10 out of 10. No. Nope.
Probably wasn't a 10 out of 10, but it's okay. That's how y'all kind of stay in that world.
That's
though.
right.
In
That's
our own
great.
world.
In your own
Yeah, I
world.
know. It's a strange thing, really, to think that there can be such a big difference in perception.
Yeah.
Now, you guys mentioned urine drinking. Are you guys prescribing it? No. You are.
I was kind of
'Cause
curious
it
about
is-
that,
No.
if that's going to be a thing.
I'm seeing it on Instagram a lot, which is where I do my research. My evidence.
Your logarithm.
Excellent.
You wouldn't last a day in his
Oh,
logarithm.
I get some weird stuff. I get a lot of breastfeeding women in my.
What?
Yes, I don't know why.
Hmm.
Maybe because I'm a holistic.
Colostrum,
Yeah.
colostrum
Colostrum's
supplements.
great.
Yeah.
Yeah, I mean,
I
he's got
don't
a
know.
kid that just turned 2.
Too.
Oh,
So that's-
okay.
Yeah.
Maybe your
that's it.
phone's listening to your
I don't know.
conversations or
But
something.
Actually, that's a good point.
But
you're
no,
not-
not
Mm.
prescribing
Talk about it.
urine drinking.
No,
That's
you
not
wouldn't.
being
Because
prescribed.
people are doing this like as it's a
know.
big
There's
thing.
a lot. I think that's one
Bee
valuable
stings.
thing to us for
Yeah.
for having a practitioner. They're like, there's information overload
Right.
out
You gotta
there.
filter it
Like there's a million, and it's always if you're not doing this one, this is the one supplement that you need, and it's like
Right.
that actually might not even work well
Yeah.
with your genetics
Right.
or what you've got going on, or you have to eat this superfood. Well, maybe you have molds and you have super high histamine,
Right.
and that superfood is not going to be great for you. So, yeah, Instagram's an overwhelming
Yeah.
place. So come.
I want to
have
come
a
and just get a
practitioner.
full test of
Yeah.
everything.
Yeah.
Take a dump in a box for you.
Do a
rectal
big
ozone.
bag,
that.
ice therapy.
So-
while you're getting your skin pinned.
I'll do the beanbag dip. No, but you guys work with people that generally are awesome and feel pretty good and just want to continue that journey the rest of their life. Like,
99.9%
okay, good.
excellent people.
Good. That's what I need is just to make sure I stay at that level.
Yeah, and I appreciate that you guys are just normal in the healthcare space too, which
Because there are some weird holistic docs.
that's
Or
kind of been the issue too.
Not
is
us.
Which
Not
can
us.
turn people so far the
Oh,
other
God,
direction, and then they
yes.
don't believe in any of the evidence-based stuff because they lump the pee drinking
Well,
in with
yeah.
the ozone, or for instance,
Or-
and you're like, these are not on the same.
or the
playing
person's
field.
just like too multi-level marketing pushing their
Oh,
yeah, yeah.
product
Yeah.
instead of what the person
person.
actually
Right.
needs.
Well, no
Right.
joke. There are chiropractors that shine a light on somebody and adjust the shadow on the wall, and like
I'm
are
sorry,
still.
what?
Yeah, it's a thing.
Yeah.
Which I'm looking into. If anybody's interested.
because I don't have to touch you.
But yeah, but if you went to a
Yes.
chiropractor, if you're like, oh, I'm going to check out a chiropractor today, and that's the person you walk into, it's
I'm having a hard time with that,
right.
probably.
But if you see it here, it's really normal.
I'm gonna trust
If
you've
you're
done your
in-
Instagram.
if you're
research.
into that, just give me a call. But no, really, it's strange.
All right.
Well, yeah.
Anything else? Tell people where you're
Yes.
located, how to get a hold of you, what
Still
that looks
accepting
like.
new patients, all that.
Yeah, we are located in Forest Acres off of Forest Drive in the Lowe's Food Shopping Center. So 4711 Forest Drive, Suite 9. We're right next to the CVS. You can find us on our website at rootsim.org. And from there, probably every question you have could be answered under the FAQs and appointments and pricing. We're very transparent with all of our pricing. So we do not accept insurance for office visits. So every single, down to a B12 shot to a blood draw fee, is all on there. You can contact us through there as well. You can send us a contact message. You can find us on Instagram, Integrative Medicine, Integrative Medicine. Yeah.
And if you guys ever get any bullies in the healthcare space, you got Uncle Tom and Uncle Randy here to protect you guys.
Thank
okay?
you so
'Cause
much.
we're calloused by all of that.
Yes, we appreciate that.
OGs in the holistic world.
Love
Yeah.
it.
All right.
Yeah,
Thank you, guys.
Thank you so much for having us.
Thank you.
I gotta pee real bad.
Oh, whoa.
Here
We're here for the health of it.
for the health of it.